Hey, greetings everybody. Dr. Randy Worst in Thrive Chiropractic. Thanks for joining me today. Hey, good chance that if you're watching this, you're having some pain. Even traveling down your arm, might even be affecting your wrist and causing what we call carpal tunnel or pain in the wrist as well and throughout the hand. So, hey, let's talk about this for a minute. Hey, so most of the time when you have issues with your arm and pain in your arm and your wrist, it's actually not starting there. The cause is not there. Most of the time it's in your neck, especially if you feel it travel a certain pattern. That's actually a nerve. It's related to your neck. Now, how can this happen? Well, many times as a result of this, you'll know people have been in an accident or some type of injury, whether a football, they hit their head on something, were involved in some type of motor vehicle accident or some other thing where it kind of damaged the neck. It might not show up right away. It might take a year or two and maybe 5 years later to develop. And we'll start to see that the pain starts going down, either down their arms, sometimes even in their chest and in their back as well, as far as that goes. Now, other times it's a matter of just how you hold yourself at work. I see a lot of people at work sitting down at their computer, so they're hunched over, their head's forward, and it's a gradual progression of issues with the neck that start to happen, and it starts to affect the nerves, especially the nerve that travels down your hand. It's the lower neck area is where it's affected. Now, what can you do to result of this as well? So one thing you can do is start looking at where this shows up. So is it showing up in your sleep? When you wake up in the morning or when you're doing your hair or even when you're driving the car, it'll start to show up as numbness. And those are speed bumps. Speed bumps are telling you, hey, something's yet to come. This is what symptoms do. They're telling your body and telling you, hey, something is not quite right. It's going to give you a little subtle notice with numbness, and then it progresses to pain. You know, pain when you move your neck or pain when you twist or do something with your neck here and there. Maybe it shoots in your arm, down the back of your arm, or even in your wrist too. So you might even notice this when you're doing certain movements like turning your head, you feel it a certain way. So those are little telltale signs that you're having some issues with your neck and it's related to your arm. Now, could there be some issues that are directly related to your arm? Absolutely, but that's usually a result of an injury involved. And if the pain's progressing, it's burning in any ways, then definitely consult with your doctor. But if you notice that the pain is in your wrist, sometimes it's a matter of you fell, you jammed your wrist, and it's something that's happening to your wrist. And your wrist is like a bag of marbles. It's just held together by rubber bands. So that's what the wrist can be causing an issue too. In which case, that's what I would do as well as a chiropractor, is look at your wrist, assess your neck and your shoulder. So what are some things that you can do at home to help prevent this? One thing is, if you are at a desk or if you are sitting for a kind of period of time, or a long period of time, definitely sit up straight. It's going to help get your ears right in line with your shoulders, so you're not putting your head out in front of you. That will compress the nerves over a period of time that causes damage to your neck. Now, some of the things, if you're sleeping with the type of person that's sleeping with multiple pillows and have your neck like this at night, or you feel comfortable if you're laying on the couch and you need that extra pillow because you need to prop up and see the TV, I would get rid of that. Change positions, because again, that's compression in the neck as well. Some of the old injuries that you can't resolve, you're not going to be able to, but you can do some strengthening exercises that I'm going to include as a link in this in the video. Look in the comments in the description section as well. So you can do posture exercises, getting your head up over straight, putting your head back against the wall, or what we call pillow pushes at night, pushing your head back into the pillow correct way, so you're strengthening the spine to prevent that. But a lot of times issues that this happens over a period of time, it actually creates bad habits, and those need to be undone. So if those aren't working, definitely that's when you give chiropractor a call, including myself, and I'll even check the wrist and make sure those are working right in your elbow and shoulder, because the nerves can be having problems and getting pinched there. So if this was helpful, please give it a thumbs up. If you know somebody that can benefit from this, by all means, send it to them. They'll thank you for it, because they don't want to have surgery, or they're told the only option is take pain medications until the point where they have surgery, and that's definitely not the case. We've helped many people that have arm pain or carpal tunnel type syndromes as well in this. So let me know how I can help. Give us a call if we can do so. Take care. Have a blessed day. This is Dr. Randy Words in Thrive Chiropractic. Bye-bye.